So for our first video, let's talk about viruses and how they work and how they infect you and how your body responds. A virus is essentially not a living thing, but it's essentially a protein coat with a set of instructions on the inside. It's either DNA or it's RNA, but these things aren't technically alive. They bind on to your cells and they inject their instructions into your cell, and they take over the machinery and they replicate themselves. The goal of a virus is to replicate itself. That's all it wants to do. It doesn't care about anything else. So when you get a virus, for example, COVID, it comes in through key points, and that is it comes in through the eyes, the nose, or the mouth. And the reason it does that is it's mucous membranes. If you look at your skin, you have a dead layer of cells that viruses can't get through. But the coronavirus can get into mucous cells, which are the lining of the eyes, the lining of the nose, and then the respiratory tract as well as the mouth. And those are the cells that it can bind to and inject itself into. Okay? So it injects itself into your cells, it takes over the machinery, and it starts replicating itself. And then what happens is you start getting symptoms. Your nose starts to run, you start to get a cough, and that's because those cells are lysing as they're releasing viruses. And then you're coughing into your hands, you're touching things, you're releasing droplets, and that's how the virus is spreading to other people. During this process, your immune system now has to come in and stop the virus. And it either has to stop the virus directly, or it has to bind to the cells that are already infected and get rid of them. And during that process, there are signaling molecules that go on, like little soldiers attacking an enemy, and guns and smoke and all these sort of collateral damage that happens. That's what's happening on a small cellular level. So normally we get a virus, your immune system comes in and attacks it, you feel bad, you get over it. With this virus, some people allow it to go for a long, long time. The immune system doesn't respond normally, and then by the time it does, all these inflammatory mediators that are released are now causing something called cytokine storm and a whole bunch of other bad things that tips people over the edge and into the ICU. But I want you to grasp these key concepts because this will apply to our masks, social distancing, and barriers talk. Viruses get in through the eyes, nose, and mouth. Its goal is to replicate itself. You want your immune system to get rid of it, but it's also your immune system that can go haywire and cause problems. So having a properly functioning immune system is paramount. In our next video, we're going to talk specifically about the immune system and how it functions to give you a broader understanding.